And our reporter, Lerato Fekisi, has more details on the vaccines in Port Elizabeth. Let's cross to her now.
Well, a few minutes ago, the first health official from the Department of Health, Darlene DeForce, got her jab. Now we are inside another vaccine site here at Livingston Hospital. 3,200 of those vaccines are in the Eastern Cape and they'll be utilized here. So I'll just ask my cameraman, Marcus, to show you exactly. This is the second lady getting her vaccine. How are you feeling, ma'am? Take us through exactly. The needle's going to come in your arm right now. How are you feeling?
I'm quite calm. I'm not really scared of injections. I'm quite calm, and at this moment, I don't know afterwards, but at this moment I'm quite calm and happy to take it.
And why was it important for you as a health worker to make sure that you're in the forefront of taking this vaccine as well?
Well, it's to be an example, basically, to the people outside. To take the first step to show them that it is valid, and then there's nothing to be worried about. We know there might be side effects in that, but I just feel that we as the healthcare workers, to protect ourselves, but also to be an example to the community and the people out there.
Okay, I'm going to let her take the vaccine, and I'm going to talk you through so that we forget completely about that. You don't feel anything in your arm. And then also, you've been on the forefront of this virus. How did you feel knowing that at last now a vaccine has come, because you've been fighting this pandemic as a frontline worker? Now a vaccine has come. What does that feel for you as a healthcare worker?
It feels comforting, but also we are happy that at least there's something to protect us as well, and our families and the community at large, and so that we can get herd immunity that we want. So for me, that is quite exciting to know that there is something that will eventually help us to get this thing under control.
Okay, awesome. I think that would let the lady do her jab as well. You can go for it, and give her a jab. So as you can see there, this is one of the second health officials here at Livingston Hospital, a nurse who works here, who's getting her first jab. And as you can see, strong, feeling good. It's in your arm. How are you feeling?
I'm fine. It wasn't that bad.
No pinch on the arm, not so?
No.
So definitely worth it.
It's worth it.
And what is your message to other people? Obviously, we're starting with healthline workers, and eventually we'll get to normal citizens. And there's been so many mixed emotions about the vaccine. What is your message to the ordinary citizens of Africa, and why they must take this vaccine?
I think my message would be that they should go out there, and everybody is scared of the unknown, but they should go out there and at least have some protection against this virus. Because if you don't go, then you don't have any. But if you do go for the vaccine, then at least you have some protection to protect yourself, to protect the people around you. So at least if you go, you also help us to control this virus.
And also, lastly, congratulations to you, the second person in the province to take the vaccine. Shoulder bump. Congratulations. Well, that was a health official here from Livingston Hospital saying that she feels fine, she's taken the vaccine, and if anything, she's really appealing to residents, to healthcare workers, to go out there and take the vaccine, because it is the only immunization and protection against the COVID-19 pandemic. For us, it's back to you in studio.
All right, Lerato, just before I let you go, at the moment, one can note that perhaps yourself, as you are the frontline worker in public service in as far as broadcasting is concerned, you go out from time to time, and you are also at risk of being infected when you interview people, when you prepare for your stories, traveling to different parts of the Eastern Cape. And, you know, it was one of the areas that had high infection rate. So at the moment, do you feel that you should be getting one as well, even though it's priority for the nursing profession?
Absolutely. I think doctors are frontline workers, but equally journalists are frontline workers, because every single day we have to interact with people. We have to be out in communities, and if anyone does need a jab, it is us. So I would definitely recommend myself, and I definitely will be getting a jab when the time does come, because we interact with people from different walks of life, and we obviously always expose, because in the name of telling a story, we put ourselves out there on the forefront. So I would recommend people, whether you're a journalist, whether you're a nurse, whether you're a doctor, just to protect yourself from the virus. coronavirus, and myself commit myself to definitely getting the vaccine as well, especially now that I've seen that people post the vaccine. There's a lady that I saw earlier on, and she's taken the vaccine. She feels absolutely fine. She didn't fall over. She's good. She's strong. She's healthy. And if anything, they are saying people go out there and go get your vaccine. So my commitment to you, I'll definitely make sure that I get the vaccine as well.
And I'll be right here to witness that. That's Lerato Fekisi live from Port Elizabeth.